The Healthcare Labyrinth Podcast is back for another episode. Join Marc S. Ryan, a veteran health plan and health technology executive, as he explores the world of healthcare.
Welcome, everyone, to this edition of the Healthcare Labyrinth Podcast. My name is Marc Ryan, and it's a pleasure to be hosting this podcast, and thanks to everyone listening in. This is the second week of some major changes for the podcast. You just heard some music in an intro. You'll hear an outro with some music as well. And in between, we'll have two ads. There will be an ad about the Healthcare Labyrinth website and all the resources there for you, as well as how to purchase my book, The Healthcare Labyrinth, and what it's all about. So two ads, two breaks here on this podcast. We're going to cut it into two. And the first part of this podcast is really going to be about President Biden really ramping up on a healthcare agenda to differentiate himself against President Trump, former President Trump. And then in the second half, we'll talk a little bit about a big entitlement debate going on Social Security and Medicare, and how I think all candidates seem to be missing an opportunity to really stabilize the program. And it's become very, very political, frankly, and has very little policy orientation. So let's start off in the first half here. Well, you know, President Biden has done a lot on the healthcare front, but we've really seen this come to, major focus really in the first half of March here. We are taping this basically in the middle of March. It will come out a little bit later in later March. But in the first half of March was the State of the Union address by President Biden, where he really talked about some major items that he wanted to pass on the healthcare front. And then shortly later, a few days later, President Biden's federal fiscal year 25 budget came out, and he had very similar themes in there and even more things than were beyond in the State of the Union address. Now, there was an earlier podcast where I talked a little bit and I compared and contrasted President Biden's and former President Donald Trump's healthcare policies. You can certainly go back and listen to that podcast to go a little deeper in certain areas. And what was interesting about that podcast was that in certain cases, there are a great deal of similarities. For example, on price transparency, and especially a little bit on drug price negotiations and setting drug prices and lowering them overall. And where they contrasted were on issues of Medicaid expansion and support for the exchange and the Affordable Care Act. So you can certainly go listen to that podcast. But here I wanted, and I'll touch upon some of the same issues here, but here I wanted to sort of, tell you a little more about recently what President Biden is proposing. Let's start out, though, first with why is this a fairly major issue? Well, the reality is healthcare issues are sort of taking a backseat to other major issues. And those major issues would be, the economy's status as well as immigration reform. Those two seem to be two of the biggest polling issues out there, along with crime and things like that. Healthcare has fallen a little farther back. But at the same time, it's also important to remember that healthcare always seems to be on people's minds. So if you look at other polling beyond ranking the economy and crime and immigration higher than healthcare, you also see a couple of themes. Number one, you will see that all polls seem to suggest that people are very worried about the affordability of healthcare. And number two, they are worried about their coverage future and what's going to happen. And so those are two major issues that are in people's minds. And generally speaking, while the polls are not as strong as perhaps on affordability and keeping my coverage, there also appears to be pretty good support across party lines for maintaining the Affordable Care Act. Democrats and independents seem to favor it a great deal. Depending on the poll, you can have slightly different outcomes for Republican voters, but even a third to 40%, let's say, of Republican voters will argue the Affordable Care Act should be kept. And that is still a major share of Republican voters. So even though these issues have taken a back seat to other issues, they are clearly on people's minds, and they will probably impact in the end who many undecided voters will vote for. And a second issue that I'd mention is the fact that this election, once again, will be decided in a handful of states because we have the Electoral College. And even within states, it's also true that a handful of counties within states, which tend to be swing counties or swing states overall, will decide the election and probably push one candidate or the other over the amount of electoral votes that they need. And it's going to be a very close election again. And that's where some of these secondary issues may come into place. And that's where I think healthcare issues will come in as well. And I note that I'm not the only person talking about this potential for a handful of counties to decide it and how healthcare may come into focus. In a recent column, Kaiser Family Foundation president and CEO Drew Altman, who I have tremendous respect for, echoed these views in a recent article, as I said. And again, he said, while healthcare is not at the top of election issues, it could very well play a part in deciding the election. So that's a little bit why the healthcare issue is important, and why I think the Biden campaign and President Biden himself are pretty smart for raising the issue of healthcare, because it will resonate throughout the country, but it will probably especially resonate within these swing counties out there. Now, again, as I said, President Biden has sort of prioritized healthcare issues throughout his tenure. We know that coming into office, he sought to roll back some restrictions that President Trump placed on Medicaid. He also ramped up enrollment and took away some of the restrictions on the exchanges and the Affordable Care Act as well. So he clearly came in a bit swinging on these issues. And for that reason, for example, the exchanges now have record enrollment, and even Medicaid has seen major expansion as well, even beyond the COVID flexibilities that were put in place under Trump and continued under Biden. So some of those issues have clearly resonated early on and led to greater coverage. But the president's focus really has started coming in 23 and 24. And in the first half of March, in both the State of the Union address that occurred, as well as his federal fiscal 25 budget in the first half of March as well, started to lay out the election agenda, so to speak. And let's talk a little bit about what the president proposed in his federal fiscal year budget and in the State of the Union. And so basically, we're going to start out with the Inflation Reduction Act's Medicare drug price negotiations. I also did a major podcast on this as well. We won't go that deep. But what the president proposed in the State of the Union as well as in the budget was really massively expanding what is sort of a very constrained Medicare drug price negotiation act that was passed a few years ago. Right now, the first 10 drugs the prices of those drugs are being negotiated. They will go into effect in 2026. But the current law only calls for about 60 total drugs between the Part D retail drug program and medical drugs that are covered in Part B to be negotiated. So 60 drugs out of hundreds and hundreds of drugs. the president in the budget and the State of the Union proposed that this number be increased to 50 drugs per year over a decade. So as many as 500 drug prices would be negotiated over time. And so that was really a huge stake in the ground. The president saying, I really believe in Medicare drug price negotiations, and I want to massively expand that. And that should certainly resonate with voters because they do feel like drug prices are one of the biggest affordability issues in healthcare overall. The president in the State of the Union also proposed that the Inflation Reduction Act's rebate and inflation caps really be expanded now to the commercial world. They are only really in the Medicare world. There are some provisions within the Medicaid world related to price increases. But what the president wants to do is sort of extend this over to the commercial world. And in the case of inflation caps and then rebates, if a drug maker increases the cost of a medication each year over a certain percentage threshold, they have to automatically give back the amount over in a sort of new rebate related to overcharging on annual inflation rates. So right now they're in place in Medicare, and he wants to extend that to the commercial world as well. Next, in the drug world as well, to close out the drug world area, in the State of the Union and in the budget, he's proposing two other things as well. So in Medicare, basically the amount of out-of-pocket cost sharing in Medicare will drop to $2,000 for a Medicare member in 2025. The president also wants to extend that cap to everyone in the commercial world because of the overall cost of drugs. And also in the Inflation Reduction Act, we saw the Medicare cost sharing each month drop to no more than $35 per month for insulin. And the president also wants to extend that to the commercial world. Next, he also proposed a great deal of things related to coverage. And I just want to talk about a couple of those things here. Well, number one, as we know, he is a big fan of the Affordable Care Act and the exchanges, and he won passage and extension of enhanced premium subsidies in the exchanges that now go through the end of 2025. Well, the president is proposing to make those expanded subsidies permanent. And many say that notwithstanding the liberalization and marketing dollars that Biden put in, the most substantial reason for the record enrollment in the exchanges is because of these enhanced premium subsidies. It really attracted people to come in, and they said they were more and more affordable. So he wants to make those enhanced subsidies not expire at the end of 2025 and make them permanent. He also proposed that there are many people in states, about 10 states, that have not expanded Medicaid that are in a so-called coverage gap. Theoretically, they are too rich for Medicaid because they're over a Medicaid income threshold, but they're actually too poor, believe it or not, to qualify for exchange subsidies. Would that begin at 100% under current law? So what Biden wants to do is create a Medicaid-like program for these individuals that are in states that have not expanded Medicaid to allow them to gain coverage. And so there's, probably somewhere around several million people that would gain coverage in this way. Either they're not at all eligible now, or they might actually come into the system because other family members and things like that might get covered. And last, on the coverage front, the president is also proposing to sort of enhance eligibility both in Medicaid and S-CHIP. And he's really encouraged continuous eligibility and expanded eligibility for a number of different groups. like pregnant moms and children, and he proposes to continue to do that in both Medicaid and the state children's health insurance program. So there you have three sort of coverage initiatives: the coverage gap program, making the ACA exchange subsidies permanent, and further expanding eligibility in both Medicaid and in the state children's health insurance program. Another area that he has been proposing throughout his tenure, but really didn't make a great amount of progress, but he did get some. But he's back really proposing a massive expansion of home and community-based services. We know that, there are waiting lists out there, both for what we would say are senior services under Medicaid, as well as for individuals with developmental disabilities out there. So the president is back saying that he would like $150 billion over a decade to be spent on expanding home and community-based services, really as alternatives to very expensive nursing homes and allowing people to continue to live in the community. In one last area, I'll go back to the drug front a little bit, and I really applaud the president for thinking about this kind of issue, but he is actively trying to promote the uptake in the market of biosimilar drugs. These are drugs that are sort of like generic drugs that are much less costly over time than some of the very expensive biologic drugs out there. And these biosimilars could save a lot of money for consumers and out-of-pocket costs, and certainly billions of dollars over time for the health plan, the health system in general. So he's talking about automatic substitution and other changes for biosimilars. And I would also say that the FDA, frankly, as part of the budget, also has a major proposal where they are really attacking the issue of brand drug makers stopping the introduction of generics. And really, FDA wants to emphasize, as with biosimilars, the massive adoption and quicker introduction of generic drugs to the market. So these are all major areas that the president is focusing on, and that all came out of the State of the Union in the federal fiscal year budget. Now, I want to sort of add one other thing here that I also think is interesting. Although he did not mention it in the State of the Union, he has made antitrust and competition a major focus of his administration. He issued an executive order and directed departments to really move forward on antitrust matters. His major concern, and I certainly share this concern, is that there are hospitals taking over physician groups, hospitals taking over hospitals. There are private equity firms that are investing in both hospitals and in physician groups. And there's just a massive consolidation in the provider world. As well, there's also concern that payer purchases are becoming much too much as well. And that consolidation in the payer world are doing really two things, whether it's provider or payer consolidation. The concern is that prices are going up and quality is actually going down. So the president issued an executive order, is trying to strengthen the role that his Federal Trade Commission and Department of Justice have in scrutinizing consolidations and mergers, and also helping arm the Health and Human Services Department with additional functionality to play a deep policy role on antitrust and competition as well. And so just in the last week or so, the administration issued a request for information, and it also announced an investigation of private equity firms' role in the healthcare industry, again, arguing that these firms take excessive profit and hurt quality and patient care, much as consolidations and mergers do. So that's sort of really the background on the president really putting healthcare back on the table. And so just in summary here, we talked about the fact that he really emphasized the exchanges and Medicaid up front. He obtained the passage of the Inflation Reduction Act's Medicare drug price negotiations. And just in the last month or two, he laid out a very aggressive campaign agenda where he is going after many of these same issues and really expanding on them and looking to use them in the next 8 months or so of the campaign as he seeks re-election here. Now, going back to the issue of Donald Trump, I think the criticism I have of Republicans in general, but certainly Donald Trump here, is he hasn't really articulated much of a message on healthcare. The only real message, as I noted earlier, was the fact that he indicated that he wanted to once again repeal the Affordable Care Act. And I personally think that's a bad move, and I'm a Republican. I believe in the Affordable Care Act. I believe in upfront coverage. And what really is disturbing to me about the president's proposal is he's deep into his campaign. He didn't have any real struggles in the primary, and he could have put forth a very definitive alternative to the Affordable Care Act, but he's just never done so. And even during his tenure as president, he never had a really good proposal that made sense, saved money, and lowered overall costs. So he's proposed the repeal of ACA, but he has not really articulated any really firm message on healthcare or a firm alternative to the ACA moving forward. Again, going back to his original tenure, he did have some sympathy on the drug price front. During late in his tenure, he proposed that there would be drug price negotiations for Part B drugs, the medical drugs, the expensive medical drugs, and over time, adoption of what's known as international reference pricing, where we would set prices based on what they are in other countries, was something he proposed. He also said he was interested in doing that for Part D retail drugs. But nothing really ever came of that. Admittedly, the President Biden pulled back on that because there were some issues in the law, and the Trump administration probably did not follow the Administrative Procedures Act in issuing it. But nonetheless, President Trump did propose something fairly novel on healthcare, but he really hasn't underscored his belief in that and really made healthcare much of anything in his campaign at all. I say he sort of feels like he doesn't really have to lay out policies because he's a former president, and I absolutely disagree with that concept. So that's really sort of what's going on with President Biden and President Trump on healthcare. And I'd reiterate, I think Biden is being very smart politically here, notwithstanding healthcare being lower in the polls, where Biden may have to win votes. He might get a great deal of sympathy despite some of his problems in trying to obtain votes this year because of his healthcare policies. He may win votes in these swing states or in these swing counties, which are a lot more moderate, and probably have the issue of healthcare on their mind more than perhaps other voters. So just a quick sum up here about President Biden putting healthcare firmly forward and why it could mean a great deal for him during the election. With that, what we'll do is we'll take our first break here, and then we'll come back with a bit of a discussion on entitlements and what the two candidates are saying about entitlements.
The Healthcare Labyrinth is no ordinary website. It features news and commentary from one of the nation's leading healthcare policy and technology experts. Mark Ryan combs the internet for the latest healthcare news and publishes a news feed each weekday with summations, and Marc's insights. Twice a week, Marc publishes a blog to go deep into a current issue. And of course, Marc hosts a podcast each week to delve even further. All of this is available at healthcarelabyrinth.com. Visit each day for the latest happenings in healthcare. As well, learn more about Marc's book, The Healthcare Labyrinth, at the website. That's healthcarelabyrinth.com, your go-to source for healthcare news.
Welcome back, everyone. And we'll start with the second portion, still on the election, but really more focused on what I call the great entitlement debate. And I don't really use the word great in the way many would think about it. I really think it's a bad entitlement debate. So I use that word with a little bit of irony here. So what's been happening on this front? Well, as we know, two major entitlements, one, the Social Security entitlement, and number two, the Medicare entitlement, are really facing huge financial problems moving forward. So when we look at Social Security, the Social Security trust funds will be depleted at some point in the 2030s. So we're about a decade out, less than a decade out, of having major impact here. And the Congressional Budget Office projects that Social Security benefits might have to be reduced by at least 20% if no changes are made to the revenue coming in or the amount of checks and dollars going out. It's as simple as that. So we're facing a depletion sometime in the 2030s. And the real fear that Social Security is going to have to be reduced moving forward. I will say that very few people out there, frankly, are talking at all about how to reform Social Security in Congress or among the executive branch. As usual, politicians generally are kicking the can down the road. Probably one of the few guys that is at least looking at it is Senator Cassidy, Republican from Louisiana. And I give him some credit for at least one saying that Trump and Biden really have no agenda or no policy reform at all in Social Security. He's sort of attacking both of them. And at the very least, Cassidy is looking at creative ways to bolster the fund more on the interest and revenue side than anything. But at least he's sitting there talking about it. Let's talk a little bit about Medicare here, which will really be our topic. And in the case of Medicare, that Part A trust fund, which covers hospitalization and other facilities by and large and some home care, is projected also to run dry sometime in the 2030s as well. And so that's a serious issue, right? We already know that the inpatient benefit is a bit Spartan in many ways. There's a very large deductible that many people cannot afford when they go into the hospital. And there's also ultimately a cap on the number of days and very expensive per day cost sharing when you're in the hospital for a long time. So that can clearly bankrupt people. And yet this fund is going to go bankrupt in the early 2030s. And we also do not have anybody really talking about what we're going to do here. I will talk a little bit about a new Biden proposal in a second. But let's get back to why this has really become an issue in the campaign. Well, it really goes back to former President Donald Trump, who is almost never scripted, basically answering a question about his views on entitlements. And has anything changed his mind based on what he has been saying in the 24 campaign, that he would not be touching Medicare or Social Security entitlements at all? And I'm going to just read a quote here, because to that reporter, Trump declared the following, quote, "So first of all, there is a lot you can do in terms of entitlements, in terms of cutting, and in terms of also the theft and the bad management of entitlements, tremendous bad management of entitlements. There's tremendous amounts of things and numbers of things you can do. So I don't necessarily agree with the statement. So there, Trump, to me anyway, did not go back on his commitment not to impact the Social Security or Medicare entitlements from a benefit perspective. I think it was pretty clear he was talking about tackling waste, fraud, and abuse and administrative operational problems and things like that. But, in politics, words like that and having going off script sometimes create problems. And despite the fact that it was reasonably clear that Trump was talking about cleaning up administration and fighting waste, fraud, and abuse, those imprecise and long-winded statements, a Trump staple, of course, tend to give his opponents openings and ammunition for attack. And sure enough, Democrats overall, including President Biden, came out on the attack, arguing that the president was talking about really impacting entitlements, despite his earlier declarations not to do so. And the president, shortly after Trump made those remarks, declared the following, again, quote, "Many of my Republican friends want to put Social Security and Medicare back on the chopping block again. If anyone tries to cut Social Security or Medicare or raise the retirement age again, I will stop them. Working people built this country. Even this morning, Donald Trump said cuts to Social Security and Medicare are on the table again. The bottom line is he's still at it. I'm never going to allow that to happen. I won't cut Social Security. I won't cut Medicare," end quote. So the president came out attacking, hammering, probably taking a great deal of allowance with what Trump really said. But Trump walked into this one and gave Biden a great segue to go in there on the attack. So, of course, Trump battered a little bit about what was happening. A few days later, stung by the episode, Trump sought to come back and clarify his remarks. I'm not sure he did such a great job, but here's what he said. He said, quote, "I will never do anything that will jeopardize or hurt Social Security or Medicare. We'll have to do it elsewhere, but we're not going to do anything to hurt them. There's so many things we can do. There's so much cutting and so much waste in so many other areas, but I'll never do anything to hurt Social Security," end quote. And so he tried to clean up, not the greatest remarks in cleanup, but anyway, he did so. Now, the fact is that in politics, once you make a mistake, even if you clarify or backtrack, you've created campaign fodder. And that clearly will be the case with the Biden administration. Despite the cleanup, there's no doubt in my mind that this is good fodder for the next 8 or so months. Perfect campaign ads for Biden that will certainly resonate, especially in the swing districts we talk about. They will be negative ads. They won't be entirely truthful, but they will certainly resonate. And as I pointed out recently, while the economy and the border tend to outrank healthcare as an issue, as we said on the podcast, healthcare affordability and coverage continue to be great concerns. So that's why it will be fodder here for sure. So anyway, let's do this. Let's take our last break to hear a little about my Healthcare Labyrinth book, and we'll come back with my ideas on what really needs to be done on the Medicare entitlement front.
Health plans and insurance are confusing. Our healthcare system is in dire need of reform. Health policy expert Marc Ryan tackles both issues in his book, The Healthcare Labyrinth. It is both a guide to navigating health plans and fixing American health insurance. Marc dives deep into how health plans and the American health insurance system operate. He then outlines a comprehensive reform agenda for the system as a whole, including pricing, emphasizing health and care management, and ensuring affordable access to health coverage in a private delivery model. Marc is a bit of an unconventional Republican in that he believes affordable access is the morally right thing to do, and that it is also fiscally prudent for our nation. Learn more about Marc's book, The Healthcare Labyrinth, at healthcarelabyrinth.com or search at leading bookseller websites. Available in print, ebook, and audiobook forms.
Welcome back. In this second half, we've been talking a little bit about a problem that Donald Trump had, sort of backing off his commitment on Social Security and Medicare to some degree, and the Biden administration and Democrats seizing on that. A little bit unfair, but he sort of made his bet on this one. What I really wanted to close with is, let's talk a little bit about Social Security. I mentioned the fact that no one really has a credible plan for this, but very clearly, lawmakers need to get to the table to talk about what's going to be a real Social Security reform. The truth is, we might have to do something on the tax front as well as potentially on the benefit front, whether it's age or the amount that wealthier people actually receive and things like that. Certainly, you can't impact age for people that are already retired or coming close to retirement, but you might have to look at ways to do this better. And there's also other ways to garner better investments out there too for the trust fund over time. So the lawmakers really need to get to the table on Social Security. To the degree that there's really no discussion on Social Security policy, there's no discussion in my mind that's really credible or holistic on Medicare either. I don't think either Joe Biden or Donald Trump are serious about protecting Medicare. Neither has proposed a robust plan to truly stabilize Medicare for the long term. Yes, Biden has just in his FFY25 budget proposed another wealth tax to help fund the Part A trust fund over time, but it simply extends the fund's life, and it really can't be called a true change to how we're going to run the program in the future, and it doesn't address huge inflation in the program on the spending side. It certainly doesn't close the revenue hole, and it certainly doesn't constrain costs on the spending side. And, my criticism of Biden is that he and many Democrats usually go to taxes first and never on the spending side. You might argue that Biden's Medicare drug price negotiations represent true reform, and I'll give him a little credit there. It is a good way of reducing costs in the Part D Medicare drug world, and to some degree Part B in the future on medical drugs. You might argue that the Medicare drug price negotiation bill that Biden obtained enactment of is something that can be counted as more on the policy side. And I will give Biden credit for that. It does represent substantive reform in the case of Part D retail drugs, and to some degree on the Part B medical drug side, when B and D drugs ultimately can both be negotiated. But I would argue that's just one sliver of the overall program. He really has proposed nothing of any consequence on the rest of the Part B side, except for those very small amounts of medical drugs, or even on the Part A side. So the vast majority of the Medicare program, Biden has not really proposed anything substantively there. The Trump of this election, again, refuses any real discussion on entitlement reform, including on Medicare. Somehow, again, he feels his status as a former president doesn't mean he has to sort of lay out policies during an election, which, again, I object to. This year, we did have some hope that entitlements, and more specifically Medicare, might be substantively discussed. Former House Speaker Kevin McCarthy had signed on to the idea that there should be a fiscal commission created to look at entitlements across the board, including Medicare, and that commission might propose reforms outside of the political spotlight. And then Congress would sort of have to do an up or down vote on the proposals. A Senate bill looks somewhat similar, but unfortunately, these bills haven't moved forward. And so Biden doesn't have a clear policy toward reforming Medicare. Trump has not offered anything substantive either. And the only hope in Congress was this fiscal commission. And so far, it doesn't look like that bill's going to pass. What's the public's view on sort of these things? Well, it's a little bit fickle, as I would say. At election time, the message from voters always seems to be, don't touch my Medicare, don't touch my Social Security. But at other times, the polls do show a much more sophisticated electorate. They seem to recognize the solvency problems in both programs. They recognize that there's going to be need for some type of structural reform to protect the programs well into the future, and that some changes would need to be made as well. And they seem to be open to that. But, politicians tend to look at the election time polls that say don't touch anything, and they tend, therefore, not to really dig into the issue, which I think is a huge dereliction of duty on both the Democrats and the Republicans' part. I think it's absolutely tragic that a politician will not be honest with citizens about the need for changes because of this financial state these programs are in, or much worse, they don't have the courage to actually tell them what a legitimate or coherent strategy might be that they could support in reforming these programs. So let's tell you what I would do, because I do think it's time for us to demand that candidates tell us what they truly would do on reform, and taxing the rich alone cannot be the answer. So here is my plan, taken in part but abbreviated here from my book, The Healthcare Labyrinth. I will admit, though, in the world we live in today, that Marc Ryan, if he were running for president, he would have blistering attack ads being run against him, because I am going to mention some things that people don't like to hear, and other politicians would seize upon and say somehow I'm taking away Social Security or Medicare. But the question I really have is, would the electorate, if they saw a legitimate policy out there, maybe come to realize that something really does have to be done and that there needs to be a healthy dialogue? I don't know. Nonetheless, here's my rough plan for both Medicare, and I'm throwing Medicaid in as well, as both programs are clearly unsustainable and should be reformed together. And why do I say that? Well, the most complicated cases in the nation in terms of healthcare tend to be people that have both Medicare and Medicaid. These are known as dual eligibles. And Medicaid is essentially our public program for long-term care. So acute care is out of control. Long-term care demands are going to be much greater as we age. So you almost have to, in some ways, solve the Medicare and Medicaid problems in part together. So in general, I'll also tell you that the Healthcare Labyrinth book also has a greater comprehensive plan for healthcare reform in general. But here are some of the tidbits on Medicare and Medicaid in terms of what I propose for reform. Again, would I absolutely say I think every one of these is something I would endorse? Ultimately, no. But they would be part of my agenda to talk about, to get to a compromise where we have real reform for Medicare and Medicaid. So looking at Medicare first, we may have to reevaluate and do means testing for the program, or have wealthier folks pay more for premiums and cost sharing than they do today. We would have to look at the eligibility age over time, maybe not immediately for people coming of age shortly, but we may have to look at the eligibility age. We may have to refine the Medicare payment system for medical services and drugs. I gave Biden some credit for doing that on drugs, but we really have to refine the payment system. We need to re-examine the benefit structure, such as augmenting in some areas, I believe, and perhaps deprioritizing other service areas. I think we have to get our arms around fraud, waste, and abuse. I think we see a lot of headlines about what government is doing, but it's only a tiny sliver of the fraud, waste, and abuse that we have in the program. We have to really, I believe, rein in the myriad reform pilots in traditional Medicare. Um, I think we need to get a smaller number of them out there, really test them, and really test them to lower costs and improve quality. I believe we need to foster additional growth in Medicare Advantage. And I think we need to delink the rate structure from the inefficient traditional fee-for-service system. I think bidding with risk adjustment, a true bid, by the way, not bidding based on the inefficient traditional fee-for-service system is the way to go. And admittedly, I also think we need to reform how we do risk adjustment. We really should also enhance how dual eligible populations, those eligible for Medicare and Medicaid, are overseen. Especially, we need to integrate medical and long-term care in both Medicare and Medicaid to save dollars. I think we can also allow the younger generations to opt out of Medicare with some sort of premium subsidy from the federal government that they could take somewhere else to obtain coverage. And we also obviously need to look at some changes in taxation to balance benefit and other cost savings. So that's sort of the dozen or so ideas in Medicare for reform. Let's look at Medicaid here. I think in the Medicaid world, some of the more progressive folks out there won't like to hear this, but I really feel like we have to look at the rich benefit in the onerous mandates that are in this program. They clearly drive costs. I think we should consider scaled premiums and cost sharing based on income, especially for those maybe who are sort of in expansion populations. They can't be too high because that would dissuade coverage, but I do think that scaling premiums and cost sharing makes sense. We need to reform the entitlement nature of the program. While I think Medicare probably continues as an entitlement, we should probably migrate in Medicaid to a middle ground, generous and flexible per capita cap program that would be sensitive to regional costs, the economy, inflation, and other winds that we see out there in the healthcare world. I would never want to go to a block grant because I think a block grant would not be sensitive to those types of things that a per capita cap program could be sensitive to. We need to refine federal matching grants, including reimbursing only to a certain level of benefits and income. If states want to add tremendously to benefits or even to population groups that are too high income and really not meant for a Medicaid program, I'm not sure that the federal government should reimburse for that. That might have to be 100% state decision, in my view. We do have to address low provider reimbursement in the Medicaid program. So that could actually cost a little money, but we need to desperately improve network access, establish medical homes, boost quality, and really alleviate pressure on the commercial and Medicare worlds. And so boosting some reimbursement in Medicaid would be important. We would need to institute a reasonable personal responsibility into the program. We don't really have that today. And so despite a very rich benefit, we don't see people taking personal responsibility, and there should be penalties and incentives to create personal responsibility along with, some health literacy education. And lastly, I think we need to create a national aging plan, including a buy-in strategy where the government, state and federal, would pay some portion of the cost along with personal cost sharing for these long-term care services, because we desperately need that. And we don't want people going into more expensive nursing homes by buying down all their assets and going on Medicaid. Maybe we could have cheaper costs, let them maintain some community income, but also give some amount toward their long-term care. So in summary, as I've articulated. I think both Biden and Trump are absolutely irresponsible for not having real policies to transform our entitlements for the long term. This is the election year to do it. We can't wait to 28 or 32 when we're so close to insolvency or we've actually hit insolvency. And the decision making and the flexibility we have is very low at that point. Again, both seem to kick the political can down the road on these issues. We need real policy proposals. Again, we cannot wait any longer. And again, the longer we wait to make some tough decisions, the greater the pain and the less likely we can sustain the programs well into the future. We do need sensible people who will bury politics in extreme positions for a time to strike the bargain. That appears to be what's really severely lacking in Washington today. With that, we'll conclude this podcast. See you next time and take care.
Thanks for joining Mark and the Healthcare Labyrinth Podcast. Go to healthcarelabyrinth.com each day for the latest healthcare news. See you next week on the next Healthcare Labyrinth Podcast.